Hi everyone. So this week we're going to be doing a video on shock. You did one on direct pressure bandages. So this video will be on shock. And really you're just walking me through how you would treat shock. So shock occurs because of a loss of blood, basically. So it's not getting to the places it needs to go in the body. So the heart isn't pumping effectively. A trauma could have happened to the heart, maybe like a car crash or something of that nature. Or there could be external bleeding. So a huge loss of blood will make somebody go into shock. So first and foremost, when you're treating somebody with shock or think that they're going into shock, you want to look for any sort of external bleeding and get that stopped as soon as you can. All right. What you also want to do is make sure, well, what happened before? I'll give you an example. A player on my son's hockey team dislocated his shoulder and broke his collarbone. The trainer on site was not watching him. He started going into shock, and you can tell these things just again because he was pale. His LOC changed a little bit. He wasn't. He's kind of staring off into space. He wasn't, responding very quickly. So I noticed that right away. Made sure the trainer knew, hey, we got to get him transported immediately because we don't know. Shock can happen if you don't see external bleeding. There could be internal bleeding. He ended up, like I said, having a dislocation of broken collarbone, but just the event was traumatic in itself. So he just started spiraling down a little bit, but luckily we caught it in time and got him transported right away. So anyway, so you want to look for some of those things in a person, but you want to try to catch them before they get to that point. So just make sure to check for external bleeding first. Then you'll want to make sure that their airway is open and clear. So in this case, my pillow here, airway's open and clear, no external bleeding. But I do notice that maybe they're a little pale and they're breathing rapidly. So I want to make sure that because I don't know exactly what their situation is at this point, I'm going to make sure that they lay in a supine position, which means on their back, so faces up. All right, so if you suspect anything such as a broken bone, a dislocation, just make sure those things stay immobilized, which is what I did with my son's teammate, made sure his arm was immobilized that was bothering him. You could tell right away he came off the ice and was holding his arm. So obviously that's an indication that there's something going on. You want to make sure you cover the patient with a blanket. So in this case, I wouldn't move the patient, but we're going to cover him with a blanket. Okay. Make sure that they don't lose body heat because if the blood isn't circulating as it normally would, they could be losing body heat. So you want to make sure that they're covered with a blanket. You want to speak with them in a calm and reassuring manner. Make sure you don't give them any food or drink because if they do need to go into surgery, it's best to go into surgery on an empty stomach. All right, and then last, just make sure that you're treating any specific injuries that they may have obviously without moving them too much, those kinds of things. So if they have, a cut, that's not the reason for them going into shock. It's not severe enough for it to be the external bleeding that's causing them to do it. Obviously treat those things, whatever you can. And then just make sure that you call emergency personnel, more advanced emergency personnel right away to help you out. All right, so just go through a video kind of just demonstrating those things and talking through the steps of how to treat someone with shock. And I'm looking forward to seeing you. All right, take care.